As respiratory illnesses continue to spread, Michigan health experts have issued a plea to residents: act now to protect yourself and your loved ones from the tridemic.
Our chief editor, Dr. Partha Nandi, is joining us now. And Dr. Nandi, who exactly issued this plea and then why?
Yes, so Brian, the state's largest network of physicians, the State Medical Society, and the two large health care systems, Corewell Health, and we knew that formerly as Beaumont, and Hurley Medical Center, are the ones urging Michigan residents to take precautions. And that's because of cases of influenza, RSV, and COVID-19 continue to rise. In particular, flu-related hospitalization rates for kids, as well as all ages combined, are much higher nationally than previous seasons, going all the way back to 2010. And here in Michigan, week after week, we're also seeing an increase in the rates of flu-related hospitalization numbers. Many folks don't realize that they can get very sick with bacterial pneumonia either during or after illness from the flu, especially with kids and older adults. It's unfortunate, but I expect case numbers, Brian and Glenda, to keep rising since we just had Thanksgiving and the holiday season just recently kicked off, right? Having said that, people can take precautions. You're not helpless here. When it comes to the flu, we have a vaccine. Michigan's goal is to get 4 million doses of the flu vaccine administered. Currently, only 2.2 million doses have been given. So we're 60% towards achieving that goal.
Well, Doc, Corewell Health has reported that RSV hospitalization numbers are declining. So what can you tell us about that, and how can people protect themselves from this tridemic?
So Corewell Health, Brian, just treated over 575 pediatric patients between October 31st and November 6th. Presently, numbers are down to 236 last week, so they have steadily declined, which is good news. However, we all need to stay vigilant and not take our guard down here, especially seniors, young kids, and anyone with a compromised immune system. Now, while we don't have a vaccine for RSV, we do have vaccines for COVID, and we've talked about this. You know, people age 6 months and up are eligible, and it's really important to stay up to date with boosters as protection does decrease over time. And there is a vaccine to help with pneumococcal disease, which is caused by strep pneumonia bacteria. This is the most common cause of bacterial pneumonia, and we can help prevent it. And children and those at risk are eligible. In addition, you know, people can take precautions like simple things: wash your hands frequently, disinfect high-touch areas, and avoid people who are sick. I think if we just take precautions, be vigilant, I think we can get through this.
All right, a scrubbed-up Dr. Nandi joined us live today.
Yeah,
Doc,
I couldn't make it down there. We were still at the hospital.
Appreciate your time, sir. Thank you as always. And if you have a health question for the doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter.